to incorporate our work into her PhD dissertation, and it's been an absolute pleasure working with her. So welcome, Andrea.
Thank you so much. Thank you. Okay, let's share my screen. Sorry, just one second. All right, can you see that okay, Jade?
Yes.
Okay. All right, I kind of changed the title just ever so slightly from the email announcement, but we're looking at geographic access to essential surgical care in Mongolia. So we have this lovely team here, which also is made up of both myself and Jade, and then a few individuals from Mongolia, Dr. Jim Vanderslice from Public Health, and Dr. Ningwan from Geography, who is my mentor. Now I have more than 10 slides, so I'm going to kind of go through some of these fast. If you have questions, just put them in the chat and I'll try to get to them after, since I'll try to get through this as fast as I can.
Take your time, Andrew. We've got the entire hour. If you take about 20-30 minutes to go over your content, then we can discuss for 15-20 minutes. That'd be great.
Sounds great. I will take my time then. Okay, so one of the things that happened was Jade and I connected before this project, where we published, well, we were part of a team that published an article on estimating a baseline for surgical care in Mongolia. And this was one of the maps that we had put out in our article. And the top map is representing their current access, and then the bottom map is representing what we called an improvement in access. And the red stars in the bottom map, or the plus signs, represent maybe proposed hospital locations to try and gain access to a larger population in Mongolia. And some of the things that we discovered in this paper was that, at least on the geographic side, there was so much more than that, but I'm just going to focus on the geographic side, was that 80.1% of the population in Mongolia had access to essential surgical care, and 60%, well, yet only 60% of the population outside of the main capital city of Ulaanbaatar had access. So there was this difference in overall access versus kind of maybe more the rural access. But one of the things as a geographer that I was thinking of as we were making this is that we looked at kind of the minimum inputs for access to healthcare, right? Kind of more their travel times, what the roads were. We didn't look at any barriers to access. And so that was one of the things that really sparked my interest in this, was that I was interested in kind of assessing how do barriers to movement and seasonality as well impact our access to healthcare, particularly in Mongolia. Oops. Okay. So access to essential surgical care, right? One of the things that we wanted to look at was 2-hour access. That's supported by the literature and just by patient care in general, but it's that time between bleeding and onset of death without medical intervention. So we really are kind of looking at that specific 1-hour and 2-hour access. The Lancet Commission on Global Surgery has kind of set this goal for every country or worldwide that we want to have 80% of the population have timely access to bellwether procedures, right? The emergency laps, the C-sections, and the open long bone fracture treatment. So one of the things going forward that I was interested in, and there's probably several other barriers, but one of the major barriers to healthcare in particular, right, are particularly in Mongolia, is seasonal bridges. And I'm going to kind of show you what some of those look like on the next slide. High water levels, because a lot of times people are crossing these river sections without any kind of formal infrastructure. So the high water levels would force individuals to kind of rethink their path towards a hospital. And then aquatic areas such as wetlands and lakes as well, because none of those were initially included in our first estimates. So people were, it was just kind of every direction, what's 2 hours, and everybody within that bubble was included in access. But naturally there are a lot more barriers to access to healthcare than kind of those minimal assumptions we were running on. So looking at seasonal bridges, first on what would be the left side would be kind of an example of rural seasonal bridges, where you see that there's a lot of roads that are going in different directions here in Mongolia. And a lot of these roads are crossing over these meandering river segments without any formal bridges. And in some cases, when you look at the satellite imagery at the bridges in general, because these rivers change paths so much, sometimes the bridges were either broken down or the river was kind of going around them in general. So it seems that there's a lot of complications in the rural areas in particular for bridge infrastructure, but also for the individuals crossing over these rivers, right? So it can push them miles or, hours out of the way to try and cross on a formal bridge if they are looking to get to a hospital in a specific amount of time. That can be really crucial. It is even impacting urban areas, right? This is in UB and Ulaanbaatar on the right. What I've done is kind of showed like the outer or an above imagery, a satellite imagery of, I believe this is the eastern side of Ulaanbaatar, and there is a river coming down through the middle of this, and you can see that there is in the white box that there is a major road that has been that continues on, but does have a river running through the middle of it. And in the bottom, you can see that there are cars and trucks that are using this to get to the other major road on the other side with no formal infrastructure. And things like this can force populations to go down and around or further. It can increase their travel times to hospitals. And when you are in need, that can be extremely problematic. In addition to the natural barriers to movement, there's also seasonality, right? This is an image of UB in the winter, and snow and ice can also really reduce your travel times, right? It can kind of shrink how far access can reach within the 2 hours and really add some challenges and complications into the access models themselves. And then the last one is more on my end of things, which is, as a geographer, one of the things that I'm really interested in is called the modifiable aerial unit problem. And this is what that looks like. So in the image on the right, you can see that there's different ways that we've broken up both the spatial scale or the zonation of different aggregations. And basically what that can do is it can really change or add a source of statistical bias. And it can significantly impact your results, right? You can get different variations if you have the same point structure on each one of these figures, but you change this either the spatial resolution or the different zones, you can come up with very different aggregations or estimates. And unfortunately, a lot of papers don't even really acknowledge this. For the most part, it's only about 1% of publications really are looking at the different spatial aggregations of data. Or even really acknowledge that it's a problem. So that is extremely problematic because results may vary or uncertainty may increase with different spatial scales and zonations. So one of the things that we really wanted to look at here was if we looked at different spatial resolutions. I will show you a few images of what this looks like coming up. But if we look at the different zonations, does it really impact or change the way our population estimates are? Are they going to stay the same with each one of these, or are they going to change significantly? And we'll look at what that looks like. Sorry, having some troubles moving along here. So what we did as our methods was we wanted to do spatial or physical access scenarios. And really what a physical access scenario is, or you might also hear them called physical access models, but we're going to go with the word scenario for this presentation, is that we use a cost distance method. And really what that does is it estimates the cost of traversal. So it basically tries to put an amount of time to each one of those little squares. And then we basically add up the time until we hit 2 hours of access, right? Because as we said with the Lancet Commission, the goal is to have 80% of the population within 2 hours of access. So we really try to kind of accumulate and calculate that cost to traversal, which also includes things like elevation changes, right? And we specifically look at movement towards a facility. The reason we look at towards a facility is because if your hospital location is located, let's say like midway up a mountain, for example, you have to account for that person getting from the base of the mountain halfway up the mountain. And that cost costs a lot more when you're going uphill than if you are going downhill, right? It's a very different form of calculation, and it does slow you down if you have things like either a giant river in your way, or if you have something like an uphill or downhill slope. It can really change the way the estimates are moving forward. So we used a tool called Access Mod 5. It is supported by the WHO, and it's a tool used to characterize really that spatial distribution of times. It really tries to estimate from each of the individual main hospital facilities, what is the nearest health facility to you, and then what are basically the maximum amount of geographic space you can cover in all directions within 2 hours. And the output for this is called a raster-based friction surface. I know that gets a little bit much, but basically it's a way to count cumulative costs. And you can compare your scenarios. So let's say your first scenario has your minimum inputs, right? Only roads and land cover. But then your second scenario has roads, land cover, seasonality, and barriers to movement. You can really start to compare them side by side and look at how the seasonality and barriers to movement are changing your access scenarios. So we're going to go over each of these individually, and I'll kind of show you some images of them. But basically the data inputs for this would be health facilities, a travel scenario table, land cover, emerged land cover layer, and digital elevation. So here are the health facilities for the bellwether locations in Mongolia. Now, one of the things that I want to point out here is that UB, which is Ulaanbaatar in the middle there are multiple locations in there, right? For this particular study, what we did was we looked at 1 or 2 locations within that were centralized to UB. We didn't add all 23 or 24 that exist within the area itself because it wasn't really changing the model and it was adding a lot more complication to it. So we really just looked at kind of the center point of UB because it was still giving us roughly the same estimates, but also we were looking at the other locations. There are 2 different locations here, both IMOGs, which are their main hospital locations, but also rural generals. So there are 2 different types of hospital locations, but these are the ones that were offering all 3 bellwether procedures, right? This does not get into them separately. This gets into what facilities are offering them together as a unit. So travel scenario table, this is kind of where it gets a little challenging because what happens is basically what this table is you have a class ID, it's a number, and that's associated with a category, and it gives you the name. And then first off, what we did is we basically reviewed all the literature to find dry season travel speeds. So these were different, a lot of these speeds were pulled out of the literature and on different studies that have already been published. So these are literature speeds. These are not like real world speeds or on the ground speeds that were taken. And that is something that is an assumption for this paper and what I would say is really something that needs to be highlighted in what are real world speeds, because for the most part, they are much higher than what we are gathering in the real world. And then one of the other assumptions that we are making here is that the wet season speeds, all we did was apply a 20% reduction in the speed for wet season. So wet season would also include snow or icy conditions, right? And so all we did was apply a 20% change from the dry season to the wet season. And I personally feel that, there's a lot more detail that could be taken there. But one of the challenges there is that you kind of need to know how fast are you going in a forest? How fast are you going in a desert? How fast is it in croplands? And then anything that was labeled as water, we gave a zero, you can't travel over water surfaces is basically, we just made it so that you could only go around them. And, in not all cases is that true. So there's a lot of assumptions that are kind of being made for this particular portion of the physical access scenarios. However, a lot of it's pulled from previous literature and previous studies that have been done. Even if they have been taken in the real world and we're using them to represent Mongolia, travel speeds in Africa might be different than travel speeds in Mongolia, and particularly when it comes to different environments, right? So you really have to consider that these are starting to kind of become its own specific niche, particularly to Mongolia itself. And then we categorize them by walking, motorized, or bicycle speeds so that you could really, as you move off of roads onto land covers, you're assuming now that they're walking at a certain speed rather than traveling in a car. And one of the assumptions here is that you're only using road networks to travel at certain speeds. And I do know that Mongolia, you kind of just, there are times where you can kind of drive in whatever direction, whether it be on a formal road or not. So there are some challenges that do arise with the travel scenarios, but we tried to kind of weed that out the best that we could and try to kind of represent the real world to the best of our ability. In addition to that, I'll show you an image of what this looks like, what a merged land cover layer looks like, but basically it takes land cover types, you know, whether it's a cropland or forest or water. It also takes road networks into account, and we've kind of varied the road networks by kind of, you know, the trunks or the primary roads, secondaries, whether it's living or residential streets. And then we also added in natural barriers to movements, lakes, rivers, and wetlands. Let's start at the top left just to orient you here. What we're looking at is UB. It's actually broken up into several different segments. There's Tove, which is a surrounding IMOG, which is just an administrative boundary within Mongolia itself. And then within that administrative boundary, it's surrounding 3 or 4 different segments of Ulaanbaatar. So it's kind of broken up. It's not all one homogeneous connected administrative boundary like we're used to seeing with most of the counties here in the United States. Then I just added a satellite imagery on the right so that you can kind of see the distribution of people as we're moving from the city center and out and along the mountainsides that do reside in the capital city. You do see, I don't know if my mouse will show up here. Yeah, you can see like there's a lot of houses and yurts and kind of maybe more informal settlements that do reside on the outside of the capital city. And then you kind of have the main business districts and main capital area here in the center of the satellite imagery. Now, what you're looking at with the 2 bottom images is I talked about a merged land cover layer. So what this is each and every box that resides, let's look at this left one first where it says 1 arc. 1 arc second is a raster. It's how big the squares are within the picture. And then the 15 arc second, you can see that the squares are much larger. So what we're trying to do here is we're trying to see whether that, as I talked about, the modifiable aerial unit problem is going to impact our results later on. So I've got several different raster sizes that you'll see throughout this next couple slides. But basically the finest and the most representative of the spatial resolutions is the 1 arc second, right? I believe it's 30 meters. I do have that lined out in a later slide. I should have put it a little sooner, but I didn't. But basically each of these red lines are the main corridors of the main primary roads. The yellow lines are more the residential roads. You're getting into maybe more of those informal settlements. And then anything in green, there's a variety of categories, but they're basically land cover types. So how fast we are able to move was assigned in that table that I showed you before, but whether it's a forest, whether it's a steppe condition, whether it's a desert, you know, each one of these green ones represent land surface itself. And then at the very, very bottom, you can see that there is a river running through that. So one of the things that I want to point out here is that right now you can see the red corridors and even a few of the yellow ones, which are roads, have priority over the river surface. So that means every single road that's represented in this data set will have, in this case, they can move over any of the river systems. So that allows you to have access and flow of transportation over and through these river networks. But one of the things that happens is as I continue through the different model scenarios, I give less and less priority to some of these streets. So saying that only the primary, secondary, and tertiary roads can have access over the river segments, and the other ones are not able to go over the river segments. That kind of shows you and allows you to kind of control the flow of the population and the transportation access so that you can kind of apply the river as being a barrier within each of these scenarios. But the difference between the one on the left and the one on the right, obviously, is what you can see is the cell size really does matter. And unfortunately, as you get into these 15 arc seconds resolutions and you give priority to certain road structures, right, it takes up a lot larger segment. So it's like 30 meters versus 500 meters. And so it starts to represent a whole road being about 500 meters worth of space, which is not representative of what's on the land. But one of the problems is that you'll see some studies, they'll just pick a resolution and then they'll start to work with it. But you start to cause problems in your estimates later on because you're making a lot of assumptions based on how large those raster sizes are. But in addition, you're also you're causing kind of, you're not representing the true land speeds that are occurring both on and off the road sections itself. There's many other things that come along with that, but let's look at what this looks like. So yes, 30 meters is 1 arc second and 500 meters is 15 arc seconds. So I looked at 4 different resolutions: 1 arc second, 3 arc second, 7.5, and 15. And this is basically just showing one of the rural areas in Mongolia. And basically on the top left here, which is the one that we've decided to kind of work with the most, it is such a high resolution that it does increase your processing time. That's another reason why some places will not pick these 1 arc second resolutions, because it does require somewhat of a higher access to higher technology or a computer that can kind of handle this type of work. If you step into the 3 or 7.5 second models, you can start to process them with lower technology, which is great, but it might be misrepresenting or overestimating or underestimating your populations with access. But one of the things that you can see here in Mongolia is that, you know, these dark lines, what it's saying is that these are the ones that require the least amount of time to a health facility. I know it's hard to see, but you do have bridges here and here. And then for the most part, you don't have any bridges. This is representing a river that's running through the middle of the city. And so you have where people can only cross these main infrastructures here. As you continue on to different resolution sizes, you're losing a lot of your river because it doesn't have the majority of the cell. So what that means is for its box, it's going to get basically the road or the road network. Whatever's taking over the majority of that cell, it's going to be assigned that classification. And rivers tend not to be taking up a larger proportion of the cell. So then it will give roads or other types of land cover types priority in the classification. So these smaller resolutions will keep the river types, and as you get into these higher resolutions, it allows you to kind of almost pretend like the river is not there, and you can see that these darker numbers mean that you have faster travel times to the health facilities, and you can see here that it's almost like the river doesn't exist and people can just cross anywhere and move into the health facility, which is not true, because if you actually look at real world on the ground, this forces you to go into the city and then across the bridge to get into the health facility itself. So there are a lot of problems as you increase your cell size and you start to kind of really address that modifiable aerial unit problem. These next 2 slides are just results that we were looking at. This came from my dissertation in chapter 1, and this was looking at results for estimates of the population at the 1 arc second, and then I'll show you this one again, but the 15 arc second as well. So the top row is population count, one for the whole city or whole country of Mongolia, then Ulaanbaatar, the capital city itself, and outside UB. The reason we didn't label these urban and rural is because UB itself has half of the population, and then outside of UB has the other half of the population, but there are some urban areas that do reside outside of UB itself. So do keep that in mind, that there are some urban areas in these estimates. So we didn't really label it as rural, even though the majority of the areas are rural themselves. But as we move into the dry season coverage, this has the very minimal inputs. This is looking at the fastest travel speeds. We are again, we've almost met that same exact estimate that we had from Jade and I's first paper, which was 80.1 in the first paper. This one's 80.8. And then UB has 99.5% coverage, right? So that is extremely high, and that's great for their populations. But outside of that, you're looking at 57.3% of the population having access to essential surgical care. So very different numbers and estimates based on whether you're inside or outside of the capital city. Then we move to the next one, which is dry, which is barriers to movement, right? Barriers to movement was the aquatic areas. So basically it's looking at a 2% reduction in your population if you account for barriers to movement in the dry season. And you can see kind of moving over, it does reduce a little bit of access in UB and about 3% access outside of UB. As you start to account for travel speed differences, right? If you try to slow down how fast you're traveling to account for winter conditions, ice and snow, then you're getting that same kind of 2% reduction. And this is for the 1 arc second, right? This is the 30-meter model. So it's actually really doing a good job of it's keeping the population percentages relatively close. But if you notice, we're dropping below that 80% benchmark for the Lancet Commission on Global Surgery. So we're now, if we are applying barriers to movement and seasonality, we're no longer hitting the benchmark that we were originally hoping for. But there is an extreme difference between inside the capital city and outside. For the wet seasons, we dropped to 53.5% of the population. And then if you consider barriers to movement and seasonality together, the overall population estimates go 76.4, and then you kind of decrease to 96 and 51%. And now I showed you on the very bottom line, 76.4% would be a change in population access for 142,000 people, right? That's not a small portion of people, but that is very large, with the majority of them being in the rural areas. 86,000 people losing, I guess it's not losing, but not having the same access as what we initially had estimated, right? If you were accounting more for the barriers that they're experiencing in the real world. Now, looking at this from the 15 arc second, I'm not going to go through all of them, but I'm just going to point out, if you look at the dry season coverage here for Mongolia, we are a tad bit higher. You have to remember those cell sizes are a lot larger. So on the rural fringes, they're capturing more of the population. So we're at 82.5%. But if you apply barriers to movement and you account for the wet season, this is for all of Mongolia itself, it drops down to 68.3%, which is a huge loss. It's almost 500,000 people. So yeah, with the majority of those actually being more in the urban area compared to the rural area, but both of which are being impacted significantly if you're using that really high course resolution itself. My last slide here. So really looking at significant differences in access for inside and outside, right? They're not the same if you're comparing the rural areas to the urban areas or inside and outside the capital city. Accounting for natural barriers to movement and seasonality indicates that the country does not yet meet the goal of 80% of the population. It does suggest that there are needs to improve road conditions, particularly in areas with seasonal bridges themselves. And then the modifiable aerial unit problem does impact the results themselves. And it does suggest, which is really moving along with the literature itself, suggesting using the finest spatial resolution that you can to reduce the amount of variability in the population estimates, because using the coarser spatial resolutions can lead you to underestimate or change your estimations in your population. And in this case, about 14.2% of the population were changed by using the more coarse resolutions. Future work, we're looking at bellwethers individually. I forgot about this slide. Looking at, emergent lapse, maternal care and trauma care separately, and then really doing more research on the travel speeds themselves. One of the things we're looking at in our next work, or the chapter I'm working on now, is I am estimating each one of the bellwethers separately, but I'm also applying. We had about 16 to 17 medical residents volunteer their transportation times over 2 weeks. And so we were kind of able to look at what were the travel times towards these major health facilities and trying to get an idea of what real world speeds are. And then what other barriers can we add to the barriers to movement that may restrict movement towards facilities. And that is what I have.